So we are studying radiology. So in today's class, we are going to talk about neuroradiology. So before that, we'll discuss some anatomy of brain, okay, some basics, because it will help us to understand more about radiology of the brain. So let's start. So brain anatomy and brain functions. So in the brain, we have number of things like skull, blood vessels, arteries, neurons, meninges, brain structure, cerebrum, cortex, neocortex, cerebrum, frontal lobe, temporal lobe, parietal lobe, occipital lobe, limbic lobe, limbic system, cerebellum, thalamus, hypothalamus, medulla oblongata, pons, ventricles, CSF, brainstem, brainstem components, brainstem division, cranial nerves. So these are the brain anatomy names. So these are the brain vessels. Okay, brain blood vessels. Okay, blood vessels of the skull. Okay, the brain requires rich blood supply. Okay, so that's the reason there are number of arteries are supplied to the brain. You can see this is the brain supply to the brain. Large arteries are there. We'll call circle of Willis. This is if few minutes the oxygen supply is reduced to the brain. So what will happen? The brain death will become permanent damage. So the brain cells will damage permanently. Okay. You can see this is the neuron. How the neuron look like cell body. This is axon. These are the dendroids. Dendroids, what will do? It will collect the information. Axon, which supply the information away from the cell body. Okay. So these are the neuron. And the main important thing while we are studying neuroanatomy, the neurological traumas, head injuries are more common in neurology. So accidents, okay, most of the common accidents happen. Okay, and the trauma, someone hit on the head, or suddenly he fell down. Old age, fell down. Okay, these are the common. It will hit the skull. In the skull, we have protecting layers within the brain. We will call meninges. Meninges are the layers which separate skull and the brain. Okay, you can see that this is the skull. In that, we have dura mater. What we have? We have dura mater. This is arachnoid matter. Second layer is arachnoid matter, and third layer is pia matter. Dura matter is very hard, like skull, arachnoid matter, and pia matter. So you have an idea of SDH, EDH, subdural hemorrhage, SAH, subarachnoid hemorrhage, EDH, epidural hemorrhage. So these are the most common three types of hemorrhages we will study. Okay, how the picture look like in the scan. So these are the three types of uh, meninges which are present in the brain. So in that we have one fluid also. That is cerebrospinal fluid, which will which will revolves around the brain and spinal cord to maintain the weight of the brain. So this is the cerebrum, whole whole big brain, that is cerebrum. We have small brain, that is cerebellum. You can see you can divide the brain into two parts: a right hemisphere, say cerebral hemisphere, left cerebral hemisphere, and you have brain stem. This is the brainstem. This is the cerebellum. So whole brain is cerebrum. So then after you have to divide left cerebral hemisphere, cerebral hemisphere. Okay. Then you have cerebrum. This is the cerebrum. If you cross section one side of right side only, you have to pick up right. Okay. And you have, this is corpus callosum. This is called, this curve shape area is known as corpus callosum. Okay. And this is cortex area, the cerebrum surface. So surface area. Okay, surface area is called cortex, neurocortex, because they have higher function. Okay, and this is the 4 mm thickness neurocortex, because you can see that there are the neurons, cell, uh, cell body, dendroids, axons, everything is there. The cerebral cortex contains 25 billion neurons. So in that 4 mm thickness of whole brain, you have 25 billion neurons. Okay, so this is very unimaginable. And the cerebrum, you have 4 lobes, other than the 5 lobes also, some will tell. But if you're able to see that, you have only 4 lobes. That is frontal lobe, and after that parietal lobe, after that occipital lobe, and here we have temporal lobe, like yes, frontal, parietal, occipital, and temporal. You can see frontal, parietal, and occipital, and side temporal. If you cross section the brain or any one hemisphere, you can able to see this is another system, that is limbic lobe. And after it is corpus callosum, cerebellum, pons, midbrain, hindbrain, everything is there. We will discuss. What is the function of frontal lobe? This is for problem solving. You have memory, short-term memory. For languages, it is helpful. Motivation, for any judgment, social and sexual behavior, everything you can control or do function in frontal lobe. Next, you have temporal lobe side, is responsible for smell, smell, taste, memory, everything. And this is a language area. Whatever language you will learn, this area will have the polarity. And you have one thing is missing here, that is for ear also. This is related to ear, nose, and smell and taste. For hearing also. Next, parietal lobe. Parietal lobe also have touch, taste, and smell. Both are also available. But one key function is have Wernicke's area, means speech area. Whatever you are giving speech is coming from here. But language here, what language you are going to speech is coming from here. What type of words you have to speech, it is come from frontal lobe. So whatever we are telling, it is combination of 3 lobes. First is parietal lobe, language is temporal lobe, and understandable and controllable speech is from frontal lobe. Frontal lobe will you control you. How much amount of, now I am taking class, what I have to speak. I have to only speak about parietal lobe only. Okay, not other stuff. So who will decide? It will decided by the frontal lobe. Okay, so this is a very important function. So we are not discussing here neurophysiology, but related things. Occipital lobe, because I I think that neuroanatomy is more important. So that's the reason I'm explaining here. Occipital lobe, back side of the lobe, you have vision and recognition. You doesn't need only vision. You have to recognize that subject also, right? Like here we have the phone. Now you have to recognize that this is my phone, and you are differentiating that this is my phone, that is yours phone. So it is due to the occipital lobe. Limbic system, it is very very important, because It is the emotional area, emotional attachment. The difference between animals and the humans is only the understanding of the emotions. They have also emotions, but they have that much different than us. Limbic system, it is emotional area and the collection of memories also. Here A, B, C, D, E, F, all these are limbic system. Cerebrum, you have cerebrum. Here we have cerebellum. Sorry, cerebellum. This is the cerebrum. This is cerebellum. Cerebrum, what it will do, it will give the body movement. We are walking, we are lifting one hand, left hand, one hand, and we are walking with the after lifting one leg and keeping another leg. So why this? How this happening? Because of cerebellum, and you are balancing. You are not your balance. You are sitting very tight. You are not falling here right side now left side. Some patient will, if you want to sit them down, they will fall right side. Someone fell right will fell down left side. Okay, it is due to the cerebellum problems. Next, we have thymus. Thymus is also very important. It is the gateway of cerebral cortex. Means whatever functions you have to do, the thymus have the ability to decide. And the hypothalamus is also very important for regulation of temperature, emotional behavior, food intake, water balance, sleep cycles, endocrine system. Hypothalamus and thalamus are very, very important gland. Next, medulla oblongata. This is medulla oblongata. It is related to brainstem, pons, midbrain, and medulla oblongata. It is the control of swallowing, vomiting, sneezing, coughing, cardiovascular activity, respiratory activity, and they have cranial nerves. Medulla have cranial nerves. Okay, this is the origin of cranial nerves. The pons, this is the medulla oblongata, this is pons. Pons also have very important, this is have respiratory output, and it have cranial nerves also here, and brainstem. After that, medulla oblongata, pons, brainstem. Brainstem also is very important for breathing, heart rate, swallowing, reflexes, everything. You can see occipital lobe function is for seeing. Okay, already discussed. Taste. So we have here in the parietal lobe, we have one area that is a sensory cortex. That is, you have the responsible for taste also, and sensory area also for sense, cognition, frontal area, personality, mental status, everything, learning, intelligence, everything is related to frontal lobe. Okay, emotions are related to frontal and as well as limbic system, prefrontal, not entire frontal. Speech is also related to Brock's area, Brock's here in the temporal lobe. Language is also a vernix area, already we discussed. Hearing, temporal lobe. We have motor cortex. Mean we have motor function, lifting the hand, walking, everything. It is coming from frontal lobe itself. Sensory cortex, sensation, touching, everything. What it you are coming to the parietal lobe. Okay. So these are the important functions of brain. So let's discuss some radiology part. In the brain, we have most of the problems are coming. We have different types of problems, okay, in the brain. One is it is due to the head trauma, okay, and second types of problem are brain tumors, okay, and third type of problems are infections, brain infections, okay, or degenerative diseases, okay, and fifth one is congenital by birth diseases, okay. These are the most common, and after that we have another most common diseases like nowadays, that is stroke also hemorrhagic, and stroke is another is type of is uh, blockage, okay, hemorrhagic and clot clot type of stroke. So these all we will discuss: brain, head trauma, how many types of after trauma, how many types of diseases occurs. That is mostly hemorrhagic is related trauma only. Brain tumors, brain infections, degenerative diseases, congenital diseases, and clots are mostly metabolic disorders. That is, so there are six types of diseases mostly commonly seen in uh, neuro diseases. So here we will discuss about first is traumatic head trauma. In the head trauma, first we will discuss imaging modalities. How many types of scans to be done during for head type of traumatic modalities. So here two things we have to remember: X-ray and USG doesn't have any significant role in head or skull. No rule. So if you done X-ray and USG, it is not worthful. It is waste of money and waste of time for the patient as well as doctor. So what is the investigation of choice for traumas? Head traumas. If any person fell down, any person had injury to the skull, any person have any time beaten by any rod, any hard substance, okay, any person have accident, so whatever any injury occur to the head, what is the investigation of choice? The investigation of choice for head injury is NCCT, non-contrast computer topography. NCCT of head or brain. That is the first investigation of choice. After that, according to the condition of the patient, we will go further investigation. But one thing we have to remember: in some cases, if a person have injury, head injury, okay, but some cases NCCT will become normal. So at that time, but patient clinical condition is not is unmatchable. NCCT is normal, but clinical condition is not normal. After head injury, he lost his consciousness, unable to move his hands, unable to walk, unable to talk. Okay. So what is the investigation of choice for that person? If NCCT is normal, then the investigation of choice is MRI. And most probably after traumatic hand injury, the diagnosis is mostly DAI. DAI is nothing but diffuse axonal injury. Okay. In that case, you have to advise MRI. So after getting the report scans, you are going to see the scan. The person had clinical radiological mismatch. Clinically, patient is unconscious, but radiologically, the CT scan is normal. So then you have to advise MRI. Then you will get MRI. In MRI also, the radiology will do some sort of another. Most probably, we have DWI. Okay, DWI is the okay. Sorry, did not DWI. SWI. This scan is better for the actual diagnosis. Okay, we will not go into the detail. So this is about MRI. When you have to do MRI. Another one is if a person have head injury, the probably chances of a rupture of arteries and veins. Okay, then bleeding will occur within the brain, outside the brain, maybe probably inside the brain means brain parenchyma, or outside the brain, outside the parenchyma of the brain. Okay. And then you have to advise vascular injuries. These are vessels, arteries and veins are combined. We'll call vessels. So we have to advise CT angiography. We have to advise CT angiography here. So what is the some basic points to remember? So when you have to done CT of head, if a patient come to your clinic, when you have to do it? First is first point, major head injury. He fell down from first floor, from the bike within the speed of 40, 50, 60 kilometer per hour. Someone targeted his head and beat him. Okay. Then you have to advise head, major head injury. Major head injury needs CT head. And another one is here one is given GCS below or more than 13. Okay. Means GCS is Glasgow Coma scale. It is a scale you will able to see the motor, eyes movement, verbal movement, and motor movement. Then you have to get. Okay. Next is minor injury. But minor injury is the patient is fell down. But age is 65, more than 65 age or more than 60. He fell down. After that, he lost his concentration. Then you have to advise CT scan. If a person have headache, severe headache with vomitings, need CT scan. Okay. If a person have any fall down history, previously he had any history of fall down, but now he had headache. So then you have to advise the patient CT scan, or any history of drug intoxication, intoxication. Then also you have to advise CT scan. Okay. So these are the some things when we have to advise the CT scan. So this is all about basic things. So tomorrow we'll discuss the head injury, in that hemorrhage. Okay. Hemorrhages, different types of hemorrhages in the brain. Head trauma, in that we will discuss hemorrhages. Then afterward, skull injury also is head trauma. Brain tumors, infection, everything. These are the different types of diseases we will get. So, okay, we'll discuss. And what is the investigation of choice? How it will look like in the scan. We'll discuss everything. Okay. So this is all about in today's class. Any doubts you can ask.